Dr. John, are you sure about this?
Oh yeah, we do this all the time. Oh hey, welcome to I Hate the Dentist, Whitening and Bleaching.
I hate the dentist, I hear it every day. That's alright, you say it, 'cause I love you anyway, and that's alright. And that's alright, you hate the dentist, 'cause we love you anyway.
Hey, thanks for joining me, Whitening and Bleaching. This is one of those questions I'm asked a lot, and for good reason. It's one of the most requested dental procedures available. But sadly, there are so many products, so many choices, and just too many options. So we got to figure out what's right for you. So when patients come to my office and ask me about whitening and bleaching, I ask them a couple questions, and I found that over the years that most people fall into one of these three categories. Because we're in YouTube land and not in the dental office, we're going to add a little fun to the names. So category one, we're going on the first date, and let's call it the selfie crowd. So things are pretty white. You just need to boost them a little bit. So this is the land of whiteners and low concentration bleaching. So first let's talk whitening versus bleaching. Whitening is a mechanical process. Think toothpaste, rinses, toothbrushes. You want to return your tooth to the natural shape. You're removing surface stains with a detergent and an abrasive. Now bleaching, it is a chemical process. Whitening strips, bleaching pens, bleaching trays. You're enhancing your natural shade, making things brighter. So here's the confusing part. You will rarely see the word bleach on the front of the box in the dental aisle. They typically use the term whiteners, whitening. But most store-bought whiteners contain a bleaching agent. So we have to cover a little science. In order to bleach your teeth, you need bleach. And the most common bleaching agent in dentistry is hydrogen peroxide. Now sometimes on the packaging you're going to read carbamide peroxide, another common dental bleaching agent. But in the context of this discussion, carbamide peroxide and hydrogen peroxide are the same thing, because carbamide peroxide breaks down to hydrogen peroxide in the presence of water and saliva. Its free radical oxygen is what whitens the tooth. So out of all that mumbo jumbo, you need this takeaway. If you read anything peroxide as an active ingredient, you're bleaching your teeth. So let's get back to the categories. Category one, folks. My teeth look a little cheesy in selfies the first date. So in this situation, we need to clean off surface stain, whiten, and restore the tooth to its natural shape. And because most whiteners contain a low concentration of bleach, we're going to get a minor bleaching effect. So when you arrive to meet, hipster beard for life 25 for coffee, you don't need your teeth to inform him of your frappuccino and wine addiction. So you need to wander down the dental aisle and look for products like these. Now, they don't work overnight. They have a cumulative effect, and you have to be careful. There are some overpriced gimmicks out there, and even some products that can do some harm. We're going to talk about those in future videos. So now we got to get back to categories. So category two. So remember in my office, this was, we're going to meet their mother. Here in virtual land, let's say, my ex just friended me on Facebook. Everybody loves that day, okay? So whiteners, they aren't going to cut it. When we meet his or her mother, not only do you need to bring a nice bottle of white, you got to bring the pearly whites too. So now we have to talk bleaching strength. So remember our friend peroxide. So most over-the-counter products, they contain 3 to 20% bleaching concentration. Most professional products are 15 to 45%. So products like preloaded bleaching trays and white strips, they excel in the land of low concentration bleaching. So in category two land, we're trying to bring the tooth a shade, a couple levels up. So now when you go into the dental aisle, you need to look for products like these. So we've covered category one, first date, selfies, whitening products. Category two, over-the-counter bleaching products. We got to show the ex what a bad decision they made dumping us in 6th grade, right? And now finally, we have category three. The wedding bells are ringing. So planning is needed. We need a transformation. A tube of toothpaste is not going to cut it. Some whitening strips are not going to give us the result we need. It's time to call in the professionals. And I know, I hear it all the time, I hate the dentist, but we're going to get you past that. So remember in my office, this was the wedding bells. Here in YouTube land, let's call it a hashtag reunion, all right? So, you know, we've established you hate the dentist, and probably even more. I've been throwing some bad jokes at you. But the fastest and most effective bleaching option are professional methods. There are multitudes of options, and I'm going to cover those in future videos. But today, let's talk Old Faithful, a custom fabricated bleaching tray. So we've already talked strength, and we know that professional treatments are stronger because they have a higher concentration of the bleach. And that is very important to achieve shade-changing results. But what we haven't discussed is a very important aspect, the delivery system. So ideally, we want the bleach to contact as much as the tooth surface as possible. Think intimacy of fit. And we want to protect the bleach from too much saliva. This is going to prematurely break down the bleaching agent and decrease results. So a custom tray, it does exactly that. Since they're fabricated to fit your mouth, the intimacy of fit is superior to store-bought products. But I don't want you just to take my word. Let's look at the difference between a whitening strip, a prefabricated bleaching tray, and a custom tray fit.
So here we have all three applications. So this is a dental stone model. This is a clear whitening strip or bleaching strip. You're going to place it on the teeth as directed. You just kind of mold it around the arch. So if the teeth are well aligned, the intimacy of fit isn't bad. But if you have any kind of rotations like you see in the front side of this model or misalignments, that's where you're going to get uneven bleaching and you won't get the desired effect that you're looking for. This is a prefabricated bleaching tray. So it comes with a carrier, you follow as directed, you place the carrier in the mouth, and then it's going to leave the bleaching tray along the arch as you see here on the model. Again, if the teeth are well aligned, the adaptation is pretty well. Higher concentration than the bleaching strip, but if there's any misalignments, that's usually the issue. Finally, we have a custom bleaching tray. So this is made specifically for the patient's mouth, and also keep in mind these aren't single use like a bleaching strip or a prefabricated tray. You apply the bleach to the front side of the tray and then wear it as directed. So even if there's rotations or misalignments, because of the ideal fit, we're going to get the best bleaching results.
So category 3, it's a win-win. Stronger bleach and the best delivery system. Therefore, faster and more effective bleaching. So one final recap. Category 1, brighten your choppers, the first date. So we need whiteners, toothpaste, rinses. Category 2, we're going to meet our future mother-in-law. Whitening strips, preloaded bleaching trays. We got to bring things up a couple shades. Category 3, this is important, the wedding day, the reunion. Okay, you know, you're not going to promise to love and support them with yellow, dingy teeth. That's not going to happen. So you need to go see the guy or gal that you love to hate. A professional bleaching system is your best option. Hey, thanks so much for tuning in. Click subscribe. You do not want to miss future videos about this topic and more on I Hate the Dentist.
And that's alright, you hate the dentist, 'cause we love you anyway.